Yep.
Great.
Okay. Welcome everyone to the launch webinar on social innovations for health, brought to you by myself, Helen Serrana from BMJ, and a host of wonderful partner organisations that have made this possible. I'm just going to start with a little bit of housekeeping. I'm chairing this alongside my colleague Jo Tucker, who's supported the editorial work to bring this supplement together. First of all, please, I'm sure we're all used to it, microphones and cameras off unless you're speaking. And to highlight the fact we have got a panel session followed by hopefully a question and answer session at the end of this. So if any participants could submit questions through the chat box, we'll be monitoring that throughout. Interpretation is available. I'm delighted to say you should be able to see our international sign language interpreters already. And if you look at the bottom of your Zoom screen, there is a globe sign with interpretation, and we have French, Spanish and Portuguese translation available there. So you can listen comfortably in whatever language works best for you. Quick look at the agenda. We'll have some welcome introductions, some presentations of manuscripts, 3 of those, panel discussion and Q&A, and we will close promptly at 2 p.m. UK time, which is where I'm based. I'd like to welcome everyone from all over the world. BMJ is delighted to be hosting such a supplement and working with such a fantastic group of researchers and academics to work with us for our vision of a healthier world. So over to you, Jo, to introduce our key partners.
Thanks, Helen. We are delighted today to have opening remarks from 2 leaders who are both passionate about social innovation. Professor John Reeder and Dr. Barbosa da Silva Jr. Professor Reeder has been the director of TDR, the Special Program for Research and Training in Tropical Diseases, since 2012. And concomitantly, he serves as the director of the Research for Health Department at the WHO. Professor Reeder has a long commitment to improving health in low and middle income countries. He was the director of the Papua New Guinea Institute of Medical Research for 6 years and has received too many accolades and distinctions to list here. Since assuming the leadership at TDR, Professor Reeder has really played an important role in developing the Social Innovation in Health Initiative, SIHI. This is an initiative that helped to organize this special supplement, and all one has to do really is look at the preface or the prefaces to SIHI publications over the last several years, and you'll see the genuine enthusiasm of Professor Reeder for social innovation. So over to you, Professor Reeder.
Thanks very much, Joe, and thanks very much for the invitation to join you. As you say, I'm really enthusiastic about the Social Innovation and Health Initiative. And I think this comes to a place where we've all realized that health systems need to be transformed if we want to achieve the Sustainable Development Goals, and that community engaged social innovation can really play an important role in this transformation by engaging innovators, communities, governments, academia, private sector, a whole range of stakeholders to identify issues and develop effective, inclusive and affordable solutions. We really do need to reach beyond the existing interventions if we're going to ensure that no one is left behind as we move forward with health into the millennium. And I'm a researcher. So what do researchers do? Well, research is needed to better understand social innovations and to make sure we enhance the sustainability and, very importantly, demonstrate their impact. And in order to advance this mission, the Social Innovation for Health Initiative was established back in 2014 now, and quite some time. I still think of it as a relatively new initiative, but really gaining momentum. With the support of TDR, but also in collaboration with other important founding partners at the Bertha Center in Cape Town, LSHTM and Oxford University, and now expanded well beyond these founding partners. But the aim was to prove what works and what doesn't, and then how can we improve and scale the ideas that do work? So a very simple way of bringing research into the service of the social innovators. And I have to say, it's been an incredibly successful venture. To date, there have been 13 SIHI research hubs launched in Africa, Asia, Latin America, and Europe. And these hubs promote and embed social innovation research in the governments and academia in LMICs, aimed at accelerating this universal health coverage. So we're really pleased today to launch this BMJ special supplement on social innovation in collaboration with the BMJ, SIHI, and PAHO. And this supplement really illustrates how social innovation impact health and social outcomes and can accelerate universal health coverage. I hope it also highlights the value of research in better understanding what works and what doesn't work, and enhancing those innovations and looking for sustainability, replicability, and scale up to make a real impact with these great ideas that have come from the ground up. So I'd just like to take this opportunity to briefly thank TDO's co-donors who enable us to be able to support SIHI's work, and particularly Sida in Sweden, who've given us additional funds to support the SIHI initiative. Thanks also go to SIHI partners and other stakeholders for the contribution to the supplement. And very great thanks to PAHO, and great to see Dr. Barbosa here, and also I saw earlier Luis Gabriel, and who's been with us since the very beginning of this initiative, and really continuous support and encouragement for this. And finally, of course, to the BMJ and session, and of course to yourself, Joe, for putting a lot of work into this to bring this supplement alive. So I look forward to a really interesting launch session. And with that, I'll turn it back to you. Thanks, and have a great meeting.
Thank you, Professor Reeder. Now I'd like to briefly introduce Dr. Barbosa. He's been the PAHO Assistant Director since 2018. Originally, Dr. Barbosa was trained as a medical doctor and public health practitioner. He quickly became a leader in the Brazilian public health system, and more widely, he served as the Secretary for Health Surveillance and later the Vice Minister for Science, Technology, and Strategic Supplies for the Ministry of Health in Brazil. He served as Director President of the Brazilian Health Regulatory Agency, which is the Brazilian version of the Food and Drug Administration. He's been on a number of Brazilian delegations to the World Health Assembly, the WHO Executive Board, the PAHO Directing Council, and serving as a representative of Brazil to PAHO's Executive Committee. Most recently, he served on the Lancet COVID-19 Commission, and he is certainly one of the world's foremost public health leaders, but he is also an unflinching advocate for underserved groups and health equity, which are really at the center of social innovation. He's written about health equity and really pushed forward the health equity agenda at the regional and global levels. Over to you, Dr. Barbosa.
Thank you, Joe, and good morning. Professor John Reedy, Director of TDR, Professor Joy Tucker, Associate Professor at the London School of Hygiene and Tropical Medicine, Dr. Ashley McKean, Director of Partnership Development, BMJ, and Editor-in-Chief of BMJ Innovations, and Dr. Ellen Surana, Associate Editor of BMJ Innovations. With the launch of BMJ Innovations, a special supplement on social innovation in health, we celebrate a milestone reached by the international collaboration established to promote social innovations for health. At the Pan American Health Organization, we promote universal health and health equity, and we support grassroots initiatives to advance universal health coverage and access, improve the quality of care in health services, and establish resilient health systems. As part of our work with member states, we support social innovations for health. Social innovations in health take a holistic approach through community engagement, driving diverse stakeholders and sectors to address the social determinants of health with a person-centered process. Now, when we are living the acute phase of pandemic, we are working with our member states, how we can identify the barriers that are still preventing people to have access to healthcare services, how we can be more innovative, how we can adapt new interventions, new tools that we have, and for sure that the community engagement to identify vulnerable groups and to adopt innovative strategies to overcome these barriers is fundamental. PAHO TDR and the Swedish International Development Cooperation Agency co-sponsored this special supplement and partnered with two global networks, Social Innovation in Health Initiative, SIHI, and Social Entrepreneurship to Spur Health. Networks and collaborations have brought efficiencies by setting standards and creating opportunities for innovators and communities. PAHO has been part of SIHI since 2015 and supports the Global Secretariat and the Secretariat for Network of the Americas, SIHI-LAC, with nodes in Cali, Colombia, and Tegucigalpa, Honduras, being part of the global network of 13 nodes. The TDI started the SIHI, and I want to acknowledge the visionary work that John and his team advanced, leading to the establishment of the Secretariat in the Philippines and branching out to establishing TDR regional training centers like the International Center for Training and Medical Research in the Americas. PAHO and CIDEM co-lead the network in the Americas and co-sponsor crowdsourcing calls that take place every other year, supporting knowledge generation and exchange and promote capacity development. In this special supplement, readers will find articles discussing ways of advancing towards more resilient health systems, better health care, and ways of achieving the Sustainable Development Goals. Some articles show how networking, recognitions, and collaboration have helped social innovations to grow stronger and to be sustainable. The social innovations identified by SIHI in the Americas have expanded in reach, scope, and support. They are success stories, and they have led to improved care, shaped policies, and expanded the health service. We do believe that identifying, documenting, and calling the attention of governments and societies for these very important success stories can help them to move and to scale up and to be a real part of a strengthened and resilient health system. We look forward to the new insights this special supplement brings and how this will contribute to our technical collaboration with countries in the region. We believe that the partnerships and collaborations leading to this special supplement promote knowledge and spur the advancement of the field, and we are glad to see today the launch of the special supplement independently reviewed and published by BMJ Innovations. Thank you. Back to you, Joe.
Thanks, Dr. Barbosa. So now we'd like to go to the first part. We're going to introduce 3 different manuscripts from the special supplement. The first is on institutionalizing social innovation in the Philippines with the Castillo Award. And we have with us today Dr. Jose Cruz, the network coordinator for the SIHI Secretariat. He's a doctor of medicine and has a master's in public health. And really, this is an exciting and important way that social innovation has been institutionalized. Over to you, Dr. Cruz.
Good morning, good afternoon, good evening, everyone. I'm here to present about the manuscript titled Institutionalization of Social Innovation in Health Research, the Philippine Helia Castillo Award. So on behalf of my co-authors, I'm here to present the manuscript or summary of the manuscript. So first, what is the article about? So the article is classified as an early stage innovation report. So the content is about the inaugural run of the Helia Castillo Award for research on social innovations in health, or GCARC for short. It also provides details of how foundations for the partnership with national agencies who are conducting the award, we're late. So what is the innovation? So GCARC is a national-wide call for social innovations in health, developed by Filipinos for Filipino communities. The award is a project with Department of Science and Technology, specifically with the Health Research Division, and the Department of Health in partnership with SIHI Philippines and the Foundation for the Advancement of Clinical Epidemiology. So the conception and implementation of the award, it presents, we believe, innovative way of institutionalization of social innovation into national public health systems. So first of all, why social innovations in health? So this, the Castillo doesn't exactly address health directly. So what it does is it identifies social innovations which have been identified to have emerged to address complex problems in novel, responsive, and transformative ways, especially in lower and middle income countries. So they also have wider potential for wider impact if the social innovation is institutionalized and integrated into national policies or frameworks. And they can come in the form of products, services, models, markets, or processes. So how did the GCARC start? So first, as a summary, TDR initiated a call for identifying social innovations in health in the Philippines. Actually, this is also a global call but for specific for the Philippines, SIHI was tapped to conduct the identification. So through this process, through the call, key persons from the public health sector were invited to cooperate in various activities and events for the call, specifically those from the Department of Health and the Department of Science and Technology. They cooperated through promotion of the award or assistance in identifying innovators and social innovations. So through this process of involving them, the seeds of the idea to conduct the open calls for regular identification of social innovations began to take root, and eventually from the momentum of the initial call from TDR, these public institutions eventually decided to conduct their own, and thus GCARC was announced and guidelines were created. So just a really brief overview of how it is conducted. So there's the awarding process, which is basically just screening and reviewing and scoring of the entries. And also there's promotional activities with partners, which includes orientations with regional research consortia and innovators, and promotions through social media. So overview of the inaugural run, the results, there were 67 submissions nationwide. 10 finalists were also identified with 3 winners among the finalists. And moreover, the 2 of the winners were able to create research proposals that would upscale or further develop their innovations. These proposals were submitted to our government partners for funding. So how did the innovation help improve the health system? So first, it allowed for promotion and advocacy of social innovations in health. It contributed to an enabling environment for social innovation. It also established concrete support from the government for social innovations in health. and also for the winners, they were given an opportunity to for research to further upscale their innovations. And so with that, ends my presentation. So to leave, I would like to leave you as a quote from the namesake of the award: "Science must have a human purpose."
Thank you, Dr. Cruz. Wonderful talk. Our next speaker, Dr. Lindy Van Niekerk, is a social innovation consultant for PAHO, and she's going to be talking to us today about building the social innovation for health ecosystem in Latin America. Over to you, Lindy.
Thank you, Joe, and good morning from Los Angeles. Could I share my screen? Thank you. Joe, could I check, is that in presenter view, or do you see all the slides, or just the main slide?
It's not in the full screen view. I think you need to toggle it. Sorry.
Thank you. Right, so thank you very much for this opportunity. I'm really here to mainly share the work that's been happening in Latin America and the Caribbean, and this has been the tireless work since 2015 of Maria Isabel Echevarria at Sida in Colombia and her team, especially Jackie Alger in Honduras and her team, and the pioneering efforts from Dr. Luis Gabriel Cuervo at the Pan American Health Organization. And we've been looking at how this group within the Latin America region has been building the ecosystem to support social innovation.
And sorry, and Lindy, sorry to interrupt, but
yes.
Are you showing the main slide? We can't see your slides. Sorry.
Let us try again. Any luck, Joe?
Yes, and now it's in
okay.
right format. Thanks.
Okay, great. So the background to this work is that there's often a great focus on innovations, but not about building the ecosystem within low and middle income countries that can support and capacitate these innovations. And so much of the SIHI work, the Social Innovation Health Initiative, has been about investing in ecosystem work. Social innovation ecosystem is comprised of the actors, the organizations who really come together to shape the innovations. And I think it's the second part, which is very important, to support the institutional embedding. And a lot of research has found that the impact of social innovations are really limited until they become deeply ingrained within the institutions and within the communities. An author, Pell, defined 3 areas of innovation ecosystems, which is very important to achieving this, to support local embedding. And we find hubs and labs provide that technical assistance and resources to foster translocal connectivity, to have international and local networks of like-minded people, and to promote discursive resonance, which is more than communication for communication's sake, but really using communication as a tool to promote political and scientific legitimization of social innovations. And using this as a framework, an existing framework, we assessed the work that was happening in Latin America and how this has supported social innovation in the region. So SIHI-LAC is a regional team that's come together under a secretariat. It's comprised of SIDA, the University Nacional Autónoma in Honduras, PAHO, and several other partners who collaborate regionally around social innovation for the promotion of universal health coverage. And their work is comprised of establishing 2 hubs, each in Colombia and Honduras, who really focus on identifying social innovations in the region through the crowdsourcing calls, conducting research and capacitating the innovators. They've also established a regional network where they connect each other, foster collaborations, raise opportunities, as well as being part of the SIHI global network. And then in terms of the discursive resonance, the communication part, public awards are given, recognition, and a great investment is made in communication tools, whether it's videos, other materials to raise the profile of innovations in the area. And this work has happened since 2015. And in this paper, we assessed, did a qualitative assessment, going back, looking at what has been the impact or the influence rather on the 8 innovations, which has been selected through the SIHI LAC program since 2015 until 2021. And these 8 innovations represented 5 countries in the region. And the goal was to assess how has these innovations evolved over time and what are the lessons that can be gathered from this. And in each of the subsequent years, additional innovations have been added to this group that has been supported by the initiative. From what we've learned from this review is, in terms of the evolution of the innovations, it was remarkable that 7 of them continued and only 1 is no longer in existence. And this is purely due to the political situation within the country. The innovations who continued kept supporting themselves through a very mixed resource pool, whether it's donor funding, private funding, research funding. It was very impressive to see that 5 of these innovations have actually gone and influenced national policy. An example of this is the Zika Kids project, which has become the exemplar for the national management protocols for Zika children and their families in Colombia. And the innovations they've been able to achieve this national influence or national embedding really has had evidence of their impact, and it's heavily invested in conducting their own research to show their influence. 2 of the innovations that was part of this cohort that received support has been replicated to other countries. And of note is the Mamas del Rio initiative, which is scaled up from Peru through a bilateral agreement with Colombia for replication as a model for community health workers within their country. In terms of what the innovations valued the most from the support that they received from SIHI LAC has been the national legitimization of their programs because they have received national and international recognition. They received national recognition through the PAHO country offices, as well as international recognition through SIHI Global, TDR, and other international agencies. This has brought them as well opportunity for resources, although the team in Latin America do not give funding to any of the innovators, purely opening up opportunities for them to connect, to raise awareness of other opportunities has helped them receive that the resources that they do require. Many has felt that they had an enhanced capacity because of the technical workshops that was hosted. And this has really helped them, especially if they were earlier stage innovations, to grow and develop further. The enhanced scientific credibility has made a big difference to them as well. And often this was done through the case study research, documenting their projects, the lessons learned, and having an independent voice studying their work. And then of further note was the communications and the publicity that they received of their work. And many mentioned the films that they received as a communication tool to share with other organizations and within their country, capturing their work in a way that was kind of amenable to policymakers especially. And like many of the innovators say, it really was about visibility, about funding. A second innovator told the story of how they would not have been able to continue their work if it wasn't for the SIHI LAC team who came along, supported them, provided them the technical support so that they could go ahead and find further funding. And that really helped them move from an early stage to a more mature stage of their innovation. then SIHI has had an influence as well on the health system and on institutions in the region. Increasingly, social innovation has been included as a concept in the national innovation strategies because of the advocacy work that's happening. It's been included in national events, especially with the government agencies like the Ministry of Science and Technology in Colombia. Social innovation has since been included in international events, such as being recognized as part of PAHO's Universal Health Day celebrations. And then we're seeing a movement towards including social innovation within the training curricula of the nursing program in Honduras, but also within existing research programs that's happening and casting a light on social innovation within these. And none of this was in existence in 2015 before the SIHI Secretariat started working together. So from the learning of this experience, what is important in ecosystems work? It's bringing innovations into the light through identification and research. Often these innovations are hidden within health systems and are unknown, even to their local policymakers, let alone the international community. It's investing in multifaceted communication to help achieve this, whether that is storytelling through micro-documentaries or scientific publications, such as what the supplement within the BMJ Innovations will be achieving, facilitating that regional relational network. The importance of relationships came out on multiple occasions as a key factor driving this ecosystem. It was a very personal interaction that everyone had with each other. And then the growth of these innovations is very much because of the trust that they have within the efforts of the SIHI team, and knowing that there's a voice advocating and supporting them. So thank you very much.
Thanks, Dr. Van Niekerk. Our final presenter will be Dr. Uche Agwalonye. He's from the SIHI Nigeria Hub, and he's also a SIHI Fellow. He's going to talk to us today about crowdsourcing to increase universal health coverage. Over to you, Dr. Uche.
Thank you very much. Good afternoon, everyone. Okay. So can you see my screen? Is it visible?
Yep, looks good.
All right, thank you very much. So once again, good afternoon from Nigeria. Good afternoon, everybody. My name is Uchenna Ogwalone. I'm with SIHI Nigeria and Nnamdi Azikiwe University. I'm part of the SIHI.
Sorry about the technical difficulties. Dr. Uche, are you still on the call? It sounds like there might be some technical problems. What I would suggest is, why don't we go into the panel and we can start the panel a little early, and then if Dr. Uche can come back at the end, we can have him present at the very end. So let's go to the panel, and I think a lot of these presentations will be nicely complementary. The panel is a superstar cast of co-authors from the special supplement, and what I'm going to do is briefly introduce each of them and have them, and then I'll have some focused questions followed by a few questions from the audience. So first, Dr. Meredith Del Pilar Labarda is a professor of medicine, lead of the SIHI Secretariat, and lead of the SIHI Philippines Hub. She has led many WHO projects and done path-breaking community-engaged research. Ms. Kathleen Agudelo is Communications Officer at Sida in Cali, Colombia, the SIHI hub for Latin America and the Caribbean. She has a background in journalism and was selected as a young talent in the Colsianas project. Ms. Yusha Tao is a Social Innovation Fellow at SESH, the SIHI China site in Guangzhou, China. She recently contributed to hepatitis systematic reviews that inform WHO guidelines. And finally, we'll be hearing from Sarah Chamberlain, who's the Director of Digital for BBC Media Action in India. And a reminder to all of our panelists that these are going to be sort of lightning fast questions. So keep your answers to very brief responses. So first, I'd like to start with Dr. Del Pilar Labarda. Community engagement is one of the special ingredients of social innovation. From a research perspective, how can we best measure community engagement?
Thanks, Joe, and warm greetings from the Philippines. Indeed, that's an important question. And when we did the community engagement package, when we did that project where we organized a collection of data and documentation of community engagement experiences, practices, approaches in different regions and different contexts, the closest that we've seen how community engagement is measured from a research perspective is mostly qualitatively rather than numerically. So this includes looking at and describing process indicators that are juxtaposed with the 5 levels of community, 5 levels of participation, namely informing, consulting, involving, collaborating with the community, and empowering the community. The last one, empowerment, is considered the highest level of the degree of participation. Most of the literature also that were described in that database had a common denominator. So they had common themes such as community mobilization, individual and community agency, multi-stakeholder engagement, building on local capacity, access, acceptability, adaptability, sustainability, and inclusivity. And these are the things that are described, mostly described when we talk about community engagement. And lastly, I think it's noteworthy to mention that UNICEF came up with a minimum quality standards and indicators for community engagement, which I think is very helpful, not only in measuring community engagement, but also in its analysis and description. Because yeah, I think in SIHI, we believe that community engagement is actually the heart of social innovation. And back to you, Joe.
Great answer. Now I'd like to consider how we disseminate social innovation research. Ms. Agudelo, thinking about the community engaged social innovation research that Meredith just described, what are some of the unique opportunities for dissemination and communication?
Hi, everyone. Good morning from Colombia. Yeah, I think that communication is closely related with what Meredith said. Effective communication and dissemination of research experiences, results, and learning are really fundamental. It's really important for uptake of findings and for social impact, and to achieve that 5 steps or phases that Meredith mentioned before. So it's important to think communication, but in several lines. So it's important to communicate the results and the findings with scientific community to contribute to the generation of new knowledge, but also it's important to communicate the different results or findings with the society in general. And it's really important to communicate with the communities involved in each project. And I think that in this kind of researchers that involve community engagement, we have the unique opportunity, and is to think ourselves, how can I connect with different local channels, and how I can identify different leaders and people within the community to share the results, because when they are really empowered and they can really apply the knowledge and the new knowledge, it's easier to achieve the appropriation and the empowerment. And this is the most important aspect, because when the communities are really empowered is then when they can really achieve the change and the transformation of their own realities.
Great, thank you. And Now I'd like to turn to Yusha. You've been working on a crowdsourcing open call to solicit youth social innovations. It's called Go Youth. Can you tell us a little bit more about this call for social innovations, Yusha?
Yes, of course. Thanks, Joe. Here is Yusha from China. Let me share the screen first. Could you, okay, thanks. Yeah, our open call is called the Go Youth Global Open Call. The goal of our open call is to engage youth between 18 and 35 years old from around the world in celebrating their health-related social innovation and supporting them in further research and measuring the impact of their ideas. Our open call emphasizes the development of research capacity among selected finalists and winners. As such, this open call has a strong preference for projects with pilot data of some form of pilot implementations. The open call will accept submissions in 6 languages, including English, French, Spanish, Russian, Chinese, and Arabic. The final deadline for the contributions is about the 30th of June 2022. So I'd like to invite everyone present to participate in our open call. The challenge is free to register and participate, and the winners will receive attractive prize. We believe that your participation will broaden global public health perspectives. For all those interested in social innovation, this is a great opportunity. If you are keen to know more, on the 22nd of June, we will hold a participatory webinar to introduce youth to the Go Youth Global Open Call and to prepare them for submission. You may find more details of the open call as well as our participatory webinar on our website by scanning the QR code. Thank you.
Thanks, Yusha. And our final panelist today is Sarah. And Sarah, you've done some really fascinating work with delivered timed weekly audio messages to people's phones in India. Tell us more about this program that's the sort of part of your manuscript, and what do you see as the future for audio social innovation?
Thanks so much, Joe, for inviting me this evening. I'm joining you from Madhya Pradesh, which is the state in the middle of India, where we're collaboratively designing digital tools with women's collectives to help their members try to overcome some of the normative barriers to women's ownership and meaningful use of mobile phones. You asked me about the future of voice technology. Currently in India, 75% of adult women and 59% of adult men do not own smartphones. And wealth and education are the strongest determinants of access. In other words, people living below the poverty line who don't have the tremendous advantage of an education usually can't afford to buy smartphones and critically pay for data. Women face additional normative barriers to smartphone ownership where the value proposition has yet to be established for most women. 10 years ago, we identified IVR, basic, as critical to reaching most low-income communities in rural India, as only a negligible percentage own smartphones. We used a 5-stage human-centered design process to develop 2 voice-based mobile health education services, which we went on to scale to 300,000 frontline health workers and 10 million families in 13 states with the Ministry of Health and Family Welfare. A randomized control trial by Johns Hopkins has found that the service for families, called Kilkari, has had a significant impact on the adoption of modern contraceptive methods, the timely vaccination of infants, and it's a cost-effective approach to saving lives. We were able to achieve impact sustainably at scale with the Indian government because of our human-centered design approach, which is detailed in the article that BMJ Innovations is publishing in its supplement. Today, IVR remains critical for low-income, illiterate rural women, which is about 40% of the female population in the state where I'm sitting this evening. And BBC Media Action is committed to designing inclusive digital solutions. But it's been incredible to see here in Madhya Pradesh how women who made it to secondary school and live in slightly better off families in small towns are using Google Voice Assistant, text-to-speech, Google Voice Search, and to a lesser degree, WhatsApp voice notes to get around the obstacle of their husband's handset being English and the difficulties of typing the complex Hindi script on a smartphone. I think that's all I have time for now, but I look forward to the discussion and the questions.
Thank you so much, Sarah. That was fantastic and really exciting work. Thanks for joining us. Now, before we go to the live Q&A, I'd like to try and go back to Dr. Uche in Nigeria, and I think his connection should be better. Dr. Uche, do you want to try again?
Thank you very much. I'll try to share my screen now. Okay. So is it visible?
Yes, looks great.
Okay. All right. So good afternoon, everyone, once again. Back to the Nigerian healthcare system, there are 3 tiers: the federal, the state, and the local government. The federal is in charge of developing policies, which they scale to the federal hospitals. The state receives those policies and also scales it at the state level, with the local government also receiving those policies from the state and then scaling them to the primary health centers. Now, you have, the policies are good, but in some cases there are contextual differences from the cultural aspect, from the social aspect. Because of that, some of those policies aren't applicable generally. Now, as a result, there are some challenges around affordability and accessibility. And in some cases, you have primary health centers that are not so functional, especially in the rural areas of Nigeria. Social innovation to handle some of these challenges mentioned earlier. It engages communities and is focused on a bottom-up approach to handle some of these challenges that being seen in the local areas. It is multi-sectoral, and in some cases, we've actually seen those in the community working together with maybe the state government or the federal government, state governments or their local government counterparts to actually scale some of these innovations. At SIHI Nigeria, our approach is to use the crowdsourcing call. Now, in order to achieve that, we decided on our focus: access to healthcare, quality of the healthcare, in other words, social innovations that improve these, and also social innovations that focus on diagnosis, treatment, or prevention of the infectious disease. We were able to get a community steering group. The university was very helpful in that. We were able to develop our calls with our major stakeholder, which at the time local stakeholder, which at the time was the State Ministry of Health in Anambra State. We disseminated our call and we were able to receive about 17 submissions, which after a multi-step review process, we were able to identify 3 social innovations. These innovations were disseminated. We had a workshop at the university where we shared those solutions. The first on the list is the Okana Community Health Insurance Scheme, located in Akwa Ibom State, Nigeria. It was founded in 2014. its focus is on eliminating out-of-pocket expenses for members of the community. So you have a community where everybody who is part of the scheme within the community pays a premium, and that premium is pulled together so that even those who cannot afford that premium are able to partake of the scheme, they benefit from the scheme. And in most cases, it's much more cheaper than the National Health Insurance Scheme, which encourages members of the community to participate in it. Now, they've actually made it their own because they have a board of trustees that run the scheme. And the board of trustees, they are made of members of that community. And you also have major stakeholders from the National Health Insurance Scheme, the Local Government Council, and the Ministry of Health. And as a result of that, it has actually improved the health seeking behavior of members of that community and encourage some collaboration between members of the community and the government, the local government, and the state government. Now, the second is Drug Medics. Founded in 2018, it's a digital solution which addresses healthcare gaps by improving healthcare accessibility, access to medicines, and also providing healthcare service to members of the community. Now, it aims to mitigate mitigate the challenge of substandard medicines, particularly in rural areas in Nigeria and even hard-to-reach areas in Nigeria. So you have people, they're able to request for certain drugs on the platform, and the Drug Medics works with their stakeholders to ensure that those medicines are delivered to them at a very cheap and very convenient way. And as a result, you have the beneficiaries also are able to experience, improved health outcomes. Now, the third social innovation that we're able to identify is Packard's mobile clinic. It was founded in 2019 with the aim of addressing basic healthcare services, addressing the difficulty in accessing basic services among the target communities. So you have the Packard's Mobile Health Clinic, they have a network of doctors and nurses that they work with in different hard-to-reach areas. So people who want their services, including the elderly, including the disabled, they're able to make a request, and then they're able to receive that care right at their doorstep. So as a result of that, they have actually had a very good, they've actually been able to impact on the lives of a good number of persons within southeastern Nigeria. Now, at the end of the innovation call, we held an event where we disseminated these innovations. That was on 25th of March 2021. Now, one thing to note is that all the innovations have the potential to improve access and affordability of service to community members. And the beauty of it is that a good number of them can be applied, not just at their location, but even more places. But then that would need further research to identify certain gaps that need to be filled before that sort of scaling up can be done. Now, these innovations are being implemented. Yes, they're already being implemented, and they have a good track record. As you can see from the table on the right, you can see the improvements. This was provided by Okana West. You can see the improvement from their point of inception at 2014 for various services up to 2019. However, like every research, we have some limitations. Of course, the COVID-19 pandemic affected a lot around the dissemination efforts that we tried. So we weren't able to get the innovation call as far and as wide as we would have wanted to. But then, and in addition to that, after the initial screening, there were only about 5 that actually fell within the scope, which were sent to the expert panel and stakeholders for further review. So in conclusion, its crowdsourcing approach actually helped us identify several homegrown solutions and it presents a unique opportunity for the healthcare sector because we can identify social innovations that work for us here, and we can be able to see if we can upscale some of those innovations and apply them in other places rather from where they were These are my references. Also, at this for their support. Thank you.
And thank you so much, Dr. Uche. I'm sure we all agree that it was worth getting back to you for that presentation. In the interest of time, I don't think we'll manage to have a Q&A. We have had some questions in the question box. I would encourage you to ask some more if you have them, and our panelists and speakers may be able to get to them there. But we've had such fantastic engagement. I wanted to show you the front cover of the supplement as it will be published, and also to highlight the URL. This is the hub. This is already up where all the papers, we had a fantastic response. I'm so proud of all the papers that we have selected for publication. And just to let you know, please don't panic if it's your manuscript or the manuscript you're interested in isn't live quite yet. By the end of the week, all of the selected manuscripts will be present and be linked to from this page. So it's bmj.com/company/social-innovations-for-health. So we've kept that URL as simple as possible, but we'll circulate that widely afterwards. So in closing, I'd like to hand over to Beatrice first, and then Luis Gabriel for their summary comments. Beatrice, are you ready?
Yes.
Fabulous. Over to you.
Thank you very much, Ellen, and thank you to everyone. I'm very pleased actually to give these closing remarks together with you, Ellen, and then with our colleague, Luis Gabriel Cuervo from PAHO, who has been championing SIHI from the beginning of its inception, and managed to really identify and leverage resources to support social innovation advancing in Latin and Central America. So a pleasure to hear and see how this supplement is a great illustration of the value of social innovation to transform health system and accelerate universal health coverage, as we heard, and also an illustration of the work of SIHI, the social innovation in health initiatives and its outcomes. So we're very proud to see that. And of course, it is an amazing opportunity to showcase and engage new partners in moving forward social innovation. So we would like, together with Luis Gabriel, to also thank all the people who made this supplement possible. It's been a journey of a number of months, and we'd like to thank the SIHI China team at SIHI and the BMJ team. And it's amazing to see how the interest of BMJ in social innovation, and you becoming real champions, and we're just embracing this new partnership. So very happy to move forward with that even further. And also celebrating all authors who share their new knowledge and insight and have been really critical, some of them, into bringing SIHI where it is. And saying this, I'm thinking of Lindy, we heard, who was actually one of the co-founder and pioneer in thinking of all those things. So really, really emotional event, I would say. Thanking PAHO, of course, as mentioned, a long-term partner, and thanking TDR and John, thanking you for being there from the beginning and supporting and giving everything this initiative needed. Thanking all the donors of TDR who have been really supporting SIHI, and especially thanking our champion in the donor, Sida, giving additional support. They're really championing social innovation greatly, and not only as financial support, but as well as really great inspiration and contacts and sharing and developing partnerships. So I will turn to Luis Gabriel in case he has additional support.
Well, thank you, Beatriz. I really want to recognize you and TDR team led by Dr. John Reeder for being such a driving force in promoting and advancing the social innovations in health initiative worldwide. I think it's been wonderful and inspiring to learn about the impact that supporting communities has on using and producing evidence that helps these communities in advancing the Sustainable Development Goals and improving healthcare and health services. Importantly, as mentioned in the presentation, is building trust and engagement and promoting leadership, because it's because of trust and community engagement that many of these social innovations have been critical in the fight against COVID. And I want to thank our inspirational speakers and recognize the teams behind the production of the special supplement and today's webinar, which is quite a milestone after 1 year of collaboration of all these teams. I want to give a shout out to the 13 nodes of SIHI around the globe and thank our interpreters for enabling us to reach a broader audience that's joining today. And I want to encourage the audience to visit the website of the BMJ Innovations and enjoy this supplement on social innovation. Beatriz, you've been quite a visionary. Tell us in a nutshell what you foresee happening in the realm of social innovations in health.
Well, thanks, Luis Gabriel. So of course, we are working very hard with the SIHI to also promote and make social innovation as a field, as a research field. And this new phase is really about institutionalizing social innovation research in government and academic systems. And that is being done and started and needs further efforts and momentum from all the SIHI research hubs all over the world. So there'll be a lot of focus now on supporting an increasing number of social innovators and researchers to measure impact, demonstrate impact, communicate that impact effectively, which is very important, and also fundraise so that all is very sustainable. So thank you, Luis Gabriel. Thank you, everyone, for this great event. Over to you, Ellen.
Okay, well, I don't think I could add any more to that. We're already over time, but I'd like to thank everyone online for participating. On behalf of BMJ, it's been a real pleasure to put this webinar together and participate in it. A truly passionate and global community is quite rare and to be part of. So it's a real privilege for us, and we look forward to working together more in the future. We hope you enjoy reading all the papers that we publish in the supplement in the very near future. Thank you very much, everyone, and goodbye.